We now move to the first session of the day, entitled Stakeholder Perspectives. This block will focus on barriers patients encounter when accessing clinical trials, the importance of trustworthy information in the digital age, and the necessity of inclusive thinking in clinical trial design. We will begin with a keynote patient perspective presentation, followed by 2 short bite-sized presentations addressing communication and inclusivity in clinical research. This session will conclude with a shared discussion of all 3 speakers. Therefore, it gives me a great pleasure to introduce esteemed Anna Arellanesová, Chairperson of Rare Diseases Czech Republic and Secretary General of Eurodis, Rare Diseases Europe, to deliver the main presentation of this session. Her talk is titled Clinical Trials Without Borders for Rare Patients, Experiences of Patients from the Czech Republic. So, welcome. The stage is ready for you.
Good morning. So, thank you so much, first of all, to Lenka, who invited me to speak at this conference. I'm very honored. I will take you to a different world, entirely different world, and that is the world of rare disease patients, since I am the chair of Rare Disease Czech Republic. And I encounter everyday issues with accessing clinical trials, not in the Czech Republic, where we reside, but cross-border. So I'll take you to a different world. And I have to say that it was very interesting for me to see the obstacles that experts and scientists in the academic area face when trying to make to our patients the drugs and the treatments and the clinical trials accessible. I have a huge respect, and I am offering to be a partner on the patient platform within Creatic. Okay, let's begin. So let's start with a little bit of a background, because you may know that within rare disease area, there are 6,000 plus various rare diseases, and 60% plus of them are ultra rare, very rare. And for those patients with those diagnoses, often clinical trial is the only hope. So we hear and see all the stories. What I did after I was addressed by Lenka, I did a small research within our patient community to find out what were their experiences in the area. And not to my surprise, I have only received very frustrated and mostly negative responses saying that we have found a clinical trial, but due to administrative hurdles, various obstacles ranging from language barriers and basic problems with money to arrange the travel were discovered by us. It's often left to the parents themselves. And I am here to tell you the patient stories. And at the end of April, I did find a little bit positive story. So I would like to share it with you. I am not allowed to say the name of this rare metabolic disease, neither am I able to say where the clinical trial is taking place, but I do want to share with you the journey of the patient, of the family. The family has a diagnosis, is treated at a metabolic center, and one time they went for a regular checkup, and the doctor, being really overworked, said, I do have information for you. There is one clinical trial that is being opened abroad. Here is the name of the doctor. I cannot help you, the doctor said, because of my capacities. If you want to try and address the doctor, go ahead. So the mother, being very able, equipped with language education, went ahead and tried. That was a year ago. In April, I received a phone call from that mother saying, I want to change my answer from your survey because we are admitted to a clinical trial abroad. And I'm like, wow, how is that possible? It's like we somehow managed with just me and the doctors abroad, nobody else involved. Now their child, now an adult, which was also an obstacle because they had to open up a branch for an adult clinical trial, has already been given first dose of this clinical trial. I want to say, does it always have to begin with one sentence and a contact name? I want to say, do you always have to be on your own? And do you have to go through these administrative hurdles alone? Do you have to go through that alone? The obstacles are huge for patients with rare diseases, and they are finding, and they are either active or non-active. In that case, they do not find out. We have other stories, the stories of patients with FAP diagnosis who found there were many clinical trials available. It was a very able patient, but they were not able to distinguish between which clinical trial is actually good for them. So there's also a lot that we have to do in this area. How will the patients find out? How should they prepare? Who will pay for it? Because in the first case of the story, the family is paying for the cost by themselves, even though they were promised the cost will be returned by the company. So I'm wondering, should there be any watchdogs, any system that would monitor the availability of clinical trials that are open and that would let us know? And that makes me wonder if ORFA codes, the system for marking patients with various rare diseases, could be the future to go ahead with that. Based on my first story about the family who actually succeeded in getting into this clinical trial, I want to address what is really a problem, and that is lack of expert capacities. That doctor that has given the address to the family was clearly overworked and unable to run a clinical trial in the Czech Republic. I want to make sure that we know that the capacities of these experts for rare diseases, which we still need more and more, are over. Just the expectations are too high. They can't simply do everything, treat the patient and run a clinical trial. We need more help for them. So I'm wondering that if we are now living in an era of coordinators of care, we in Czech Republic are also incorporating a system of coordinators of care or case managers, as you will, for our highly specialized centers for rare diseases. I'm wondering if this era is happening now, maybe it's time to start thinking about coordinators for clinical trials for those families exactly that I talked about. I think it's significant to consider that help for experts to release their hands so that they can really dedicate their expertise on the patients at hand. So we really see as patient community that there is time for new legislation. And we know that there's been initiatives, especially the one EU-XCT, which has come up with recommendation on cross-border access to clinical trials. And we very much support this initiative and are also supporting the expert community and European Commission to actually move ahead and prepare legislation that would enable cross-border clinical trial participation for patients in a much easier way than in the way that I have explained in my story. As you can see, our slogan is rare but strong together, but when given the individual diagnosis, we're in this alone, and we really don't want to be in this alone any longer. So let's try and make a difference. Thank you for your attention.